My name is Sarah Obike, and I'm presenting the theory of interpersonal relationship in nursing care. This is an image of various components of interpersonal relationship, such as communication, empathy, emotion, social, etc. Theory overview. I will attempt to connect my CSP project to Peplus. My CSP project is music therapy among adult patients 20 to 50 years admitted in an acute psych hospital, diagnosed with mental disorder with psychosis, is associated with a 5-point decrease in the incidence of aggression within 8 weeks. In view of my CSP project, we will apply Peplus model of nursing interpersonal relationship. Peplus theory is a descriptive classification theory, first published in 1952 and updated in 1968. In this model, Peplus identified 4 components of interpersonal relationship. The person, as the nurse provider, assists in anxiety reduction. The environment, existing forces outside the personal control. Culture, a conceptual creation of the person's belief system. Health, a symbolic foundation of creative community living. Let's look at Peplus' model. Peplus identified 4 phases in this model. The first phase is the orientation phase. This is a problem identification phase where nursing assessment occurs when the nurse meets the patient to identify the service need. This is known as strangers' affinity for one another. You have the identification phase. The patient feels empowered as a partner in the care, thus turning the separation into aspiration for a healthy living. This phase enhances the development of care plan for the patient. The exploitation phase. The nurse employs the assessment skill with the help of professional help to interview, identify, and explore to understand the underlying issues afflicting the patient. And finally, the resolution phase. The patient need has been met through patient-nurse partnership collaboration. There is still room for psychological codependency between patient and nurse, thus solidifying the understanding between the patient and the nurse. Furthermore, how do we implement theory of interpersonal relationship? In the model, the nurse creates an environment of trust between the patient and he or herself. There are availabilities of resources as information is provided to the patient. Patients were educated on their condition, thus creating awareness as the patients recognize the limit of their knowledge. The nurse advocates for the patient in this model by creating collaborative, independence, and interdependency, which are practical, feasible, and foreseeable. How does this theory relate to de-escalation of anxiety or decrease in the incidence of aggressions? Patients were able to meet treatment goals through coaching and personal responsibility. Creation of social connections helps to maintain mental function. Encouragement and support create an environment of cognitive repair devoid of compulsive aggressions. What are the need assessments? The need-based assessments and interpersonal relationship helps to promote healthy living. Development of tools such as music and skill necessary to provide adequate intervention and therapy are essential in providing care and maintaining a consistent interpersonal relationship with the patient. Incorporation of cultural competency in the care plan for caregivers give meaning to the patient/nurse relationship. This project will project the outcome and evidence-based practice, the effectiveness of music therapy as an adjunct to non-pharmacological intervention with accompanying best practices that will be evidence-based through education and skill acquisition. It will form the basis for general knowledge in the intervention with music therapy for patients with aggressive tendencies. My references. Thank you so much for listening.